The facelift is one of the most complex operations in the aesthetic surgery, and this is because there are many structures and functional organs in the facial area that can be damaged during the surgical procedures.
The plastic surgeon.
If you like the video, please support us with a like and a comment. And don't forget to subscribe in the channel and share the video with your friends who can benefit from it too. At first, we should clarify which facial areas could form under skin soft tissues lump, and in which areas these skin lumps could be most disturbing for the patient. Soft skin lumps may form in some part of the face, mostly in the middle of the face, in the forehead, and above and below the eyelid, due to age and also to other diseases. There are many other facelift operations which we must recognize from the original operation, like upper and lower eyelid lift and eyebrow lift, in addition to other operations. And when we talk about the full facelift, then we need to see the impact on the whole of the face, including forehead, middle of the face, chin, and neck. Talking intensively with the patient about this operation is essential to understand why these limbs are formed and to check if there is any dysfunction in any part of the face and to know the parts that disturb the patient most. For example, some areas of the face may remain hanging after the appearance of facial nerve paralysis symptoms. Here, we mean the facial nerve that we want to treat with the facelift operation. Facelift operation is mostly an aesthetic surgery, which is done due to age marks appearance and the need to distribute the lump in the face down. So one of the most important reasons to have a facelift operation is the appearance of soft skin lumps in the middle and below the face. For example, facelift operation can be done too when the lower jaw features are completely wrapped, in addition to having soft skin lumps in the neck area and above the jaw. In principle, the aim of this operation is that the scars will not appear in the visible part of the face, so facelift operations in the forehead is done with microscope. Usually, forehead lift is done with microscope, in a way that the scars that barely would be visible will be on the forehead hairline. Thanks to microscopic facelift technique, we can lift the forehead along with the eyebrow. Here, the incisions will be in the hair area and behind the hairline, so they remain in the invisible areas. Whereas in the normal facelift operation, the surgical access incision is through the front hairline, then in front of the ear and around it, then it goes behind the ear. The surgical incision is so good as the scars will be barely visible. With time, when the scars are healed, they will be completely invisible. The surgical operation starts with lifting the soft skin lumps, which will be pulled from inside up, and here we have two methods to choose from. The first method is a simple one, as it depends on releasing the soft skin lumps, then lifting the skin through inserting histological slides, which in turn lift the skin. However, this method is not a long-term one. Shortly after the surgery, new structures or new soft lumps can be formed under the skin again. Here a new surgery is necessary once again. The best surgical intervention for it is what's called smash facelift. Here, soft skin lumps are released deeply that the muscle tendons area is reached. This area is inside facial structure in the deep layers, so what's called smash facelift is a far complex method, and much layers anatomical structure knowledge is needed. The dual plane facelift method is the best method for facelift, as a deep layer which is steady, strong, and durable is chosen. Facelift using such a layer is much better, but needs more efforts. Functional structures are also found in the deep areas, such as facial nerves, which in principle can be damaged during surgical operations. Based on that, surgeon expertise and skills have major role, as of course we don't want to damage any facial nerve because one damage can lead to facial paralysis. The purpose is not to have a normal facelift, but to have a tight skin through double and steady layer because of attaching deep muscle tendons with this double layer. Many surgeons who perform facelift operations don't lift all facial layers. In fact, they only release the soft skin lumps and then lift them. In this case, the impact of such a surgery is not long-term. When choosing the technique for the operation, It's essential for patients to specify with the surgeon the method in which the operation will undergo. We can clarify in detail what's the appropriate facelift method for you. In principle, we recommend full facelift method through the double layers for all skin layers, or smash facelift. That is because the results are durable and long term. After the surgery, using compression bandage is very important to ensure no bleeding, in addition to knowing whether the patient is taking some chronic medicines to avoid any risks because of medicinal complications. In principle, the patient will be occupied for 2 to 3 weeks with wound healing dressings immediately after the operation. Some lumps can appear in addition to minor bleeding for 10 to 14 days. In principle, some sense disorders might happen as well in this area. This is justified as the deep layers under the skin are released, which of course lead to cuts in some neurological sensory fibers. But often, the sense of feeling is restored in the facial area in short time. The restoration of feeling in facial anatomical structures in surgical intervened areas can last for a few months. In principle, neurological fibers must restore after 3 to 6 months until full restoration of feeling in the area where the skin is released. Facelift operation is more complicated when there was a previous one, and the current one is to correct the old one. So, if many facelift operations are done, this leads to scars fusion, so a delay in the anatomical structure. For that, the risk of damaging any functional structure is bigger. The risks of such operation are not to be ignored. The more experienced the surgeon, the less the risks. My name is Dr. Alawi, and we're talking about plastic surgeries in this channel. If you like this video, please like, comment, and subscribe. I'm very pleased to meet you in the upcoming video. Dr. Alawi. This subject is important for all. How to get the impact of facelift without surgery. My name is Dr. Alawi, and in this video, I will tell you a magical trick on how to get the impact of facelift without any operation or surgery. Many of you are interested in the method through which you can get the impact of facelift without surgery. First, we should understand what happens to the face in the inner skin part with aging. When reaching 65 years, the lower parts of the face start to loosen. This happens along with the decrease of skin flexibility, and it happens for women and men. In addition, skin becomes more full and soft skin lumps form, and we can't recognize the chin lines clearly. These are the effects that lead to a slight increase of skin, and you have the feeling that the skin is becoming increasingly loosened in this area. The first thing you can do is using retinol, which is today's cream's recommendation. Retinol is a substance for the skin renewal. The formula is said to promote skin restoration, and it acts as an antioxidant. Finally, it leads to increased lifting effects that can certainly be seen. It is not the case, as with retinol, you certainly can't achieve the effects of a full facelift operation.